I did a bit of research on you, so I just wanted to
Yes.
why integrative medicine. Okay, before you explain that, if, for example, you're told this orange will give you 500, okay, not 500, 100 milligrams of vitamin C, and this
Mhm.
pill will give you 100 milligrams of vitamin C.
Mhm.
What will
What will I?
pick?
The orange versus the peel.
Mm.
The peel.
Oh, why?
Okay, my mind has gone to now many things on the benefits and all the integrative now approach and all that stuff. So I think I'll answer your question pamoja. So one the peel question. The peel is actually more, I know it's bitter, it's more nutritious than actually the orange itself in a weird and interesting way. But one of the reasons why I would also go for the peel, it's because of how we've destroyed our soil. We are now getting plants that are not as nutritious as they used to be before. So you find, I was actually having a conversation with someone today and telling them that now we're at a point where one orange is not enough to give you your daily requirements that you need. I think right now we are doing, if I'm not mistaken, is it around 15 or 20 oranges so that you can get the grammage that you need in a day? Why integrative medicine? Whew. Hmm. First of all, it's a personal journey. I was sick for a very long period of time. I got in 2014 in the spirit of kukula sherehe nikiwa medical school. I think I overdid it.
Uh-huh.
And now when I went for internship, I was going out a lot and mostly eating a lot of meat and drinking. So I ended up with gastritis or ulcers and I lost so much weight, like extremely a lot of weight. I was about 47, 45 kgs roughly. And then I was on a very restricted diet. So I ended with a lot of nutrition, mara mifupa inauma, sijui backache, sijui nini, and I had to be on omeprazole. And now this is the problem of also having accessibility to medication because I used to pop omeprazole like patco. Unakumbuka ile patco ya white?
Yes.
I used to pop omeprazole like that because mimi, I didn't like pain. I don't like pain. Like the girl, sitaki kusikia uchungu. So anytime I would feel a bit of pain, I would take it. Anytime I take. So at some point, I developed back pain and knee pain. And then I think sijui ama mwili ilikuwa imeanza kuzoea omeprazole because at some point I had to do an endoscopy, H pylori, nikapatikana na H pylori because nilikuwa napenda
Mm.
kula pia mahindi choma. Hapo nje Nakuru PGH, there's a mama who used to choma mahindi hapo nje. I use every day nikitoka job, mahindi mzima napika naenda nayo. I work at home with it as naikula tu pole pole ama naipreserve tu vizuri nikifika kwa tu moto ndio nikae chini nikiwatch movie nikule mahindi. So gastritis just became worse. And at some point, I got so sick, I started going for IV drips. And this was between 2014 to 2018. So I got so sick. I'm small. I'm not eating, and I'm like, this can't be my life for the rest of my life. I love food. I love meat, bwana. But I love meat. Gosh. So I was like, apana, I can't be living like this. I have to pre-order when I'm going to people's homes. To my mom's home, I'm like, na msipike hii na hii, mnipikie hii. I'm
I
going for a function. Yeah, I had to. And that's the only way like I was functioning. So going out became a problem. And life needs to be interesting. Niko internship bwana. Na ninapata pesa bwana. Life needs to be interesting. Ah. So in 2018, I was like, by the way, I'm not doing this anymore. And then
Mm.
I think I was young and kuna watu wananitanga foolish, but I was young and reckless. You know that series called Young and Reckless? I quit my job. And then I, and so one of the reasons I quit was because I was trying to run a public health program because by then I had started my master's in 2017, yeah, public health. And I wanted to run a program on my account, not not asking for money na nini. All I needed was medical supplies because nilikuwa nimeingia sasa mashinani and I was seeing how bad healthcare was. So I wanted to take myself to the mashinani area. Nikaongea na waheshimiwa wakaanza kuniambia oh, you know, sijui oh. I was like, the only thing I need is a driver and a car. I don't need anything else. Like just be fluent being the driver. I'll survive on my salary, just give me medical supplies. So that didn't happen. Yeah. In the spirit of being young, reckless, and getting annoyed, nika quit.
Ay.
I quit because of that. Number two, I was like, guy, why am I treating? I'm not feeling well. I'm sick.
Mhm.
Is there another way I can help myself so that I also help other people to feel the best of their version? So when I quit is when I now discovered what integrative and like holistic approaches to health. Because in the spirit, after I quit in February, by August, I think I had gotten a job. Touch wood, because I was paying for my master's in public health na nilikuwa nalipia University of Liverpool. Sasa in the spirit ya kutafuta job, nikapata job at a wellness center. So when I went there, I described my story, being a cancer survivor, now going through all the shenanigans with my stomach, doing it. Akaniambia, you know what, we can help you. That's actually what you do. So we are giving you the job. And as we also get the job, we are going to also help you feel better and get well. And by the way, I give credit to that doctor. She's called Dr. Shana. Let me just give credit to her because
Mhm.
2 years, Madelta within 2 years, mi nilikuwa nimepona. I went back to eating different foods I was eating. So what happened is she made sure to heal my gut lining and now introduce supplementation of things that I wasn't absorbing. Remember, I'm on a very strict diet. So of
Yeah.
course sipati na nini. So I had to be put on supplementation, alafu tukaanza kuheal gut. I usually say kuheal gut is one of the most difficult things because ni kama kushona kidonda iko mahali uoni.
Eh,
Yeah,
na
so
the
if you have
slightest thing inakuwa worse.
exactly. Unajua ni kama
Eh,
ukichomeka mkono, you will shower, you will put this hand there and shower like this. But your
yeah.
stomach, 1 minute you went to a sherehe, you ate something you're not meant to be eating. Kimeumana tena. So it was a journey for about 2 years. And now when I was being helped and then I started learning on the job, I decided let me do the course and actually understand what this is. And you know what? I decided to do a master's because also practicing when you have the paper um, gives also a lot of power and credit
Mhm.
to what you're doing. So now I went and did now my master's in integrative healthcare, which now focuses on many things: functional medicine, acupuncture, osteopathy, traditional Chinese medicine, amongst other things. But now I have a liking and a loving for functional medicine because we focus
Mhm.
on chronic disease prevention and management with the aim of ensuring people have quality of life and well-being. So yeah, that's how I ended up in that field. And now it's been 4 years with a paper and 6, 7 years
Eh,
in training.
that is where we are aspiring to be.
What? Napenda tu kusoma. So now I'm into psychology. I'm telling you, I want to be so diverse. So now I'm doing psychology related courses because I've
Mhm.
realized despite handling chronic diseases, most people also come with the psychology part, the stress,
Yeah.
na nini,
Uh,
really a thing that is bringing a
especially
problem to the
correlated with stress na chronic
yes.
illnesses.
Yes.
Uh,
So you have to find the meaning. So now I'm doing a bit of psychology, and God willing, nimetegea hivi wale anybody out there in the integrative healthcare space. Jackie wants to do a PhD. I'm just saying, I want a scholarship for a PhD in the field of functional medicine, nutrition, those fields. Yes. Psychology, I am looking into those spaces. So, wale wako na scholarship, send it my way, please. I am ready to learn. Right. Yeah. Anyway, I can joke a lot. Yeah, but now I'm serious. Sorry. Yeah. So that has been me, and I've really seen the benefits of what I do because there's nothing. Let me tell you, me, I found my purpose. There's nothing as beautiful as me seeing people get better and have quality of life. You're telling me I'm sleeping well, my relationships are better, I feel beautiful, I feel healthy. Someone messaged me, I was just saying hi to their status, and they texted me and they're like, Doc, by the way, ubarikie sana because I feel beautiful from within and without in my body. And I was like,
oh,
because before
yeah,
nilikuwa nasikia I'm not beautiful, I don't feel a certain way na nini, but now amejiembrace in a whole different.
fully.
Yes. So that just
Yes,
gives
and
me mm.
legacy incoming. Like kama sisi wote we want to leave something behind.
Yeah.
That's something over here. Uko hapa, sisi wengine tuko huku chini.
Watch this space. Let me say, watch this space. 40 under 40. Ama mnaitanga nini anyway. Yes. So I have one last question for you. So if chess were a dose,
Mhm.
how would it look like?
In terms of route of administration or just normal dosing.
Both. Or however you can answer it as a pharmacist.
Um, but I can't. Okay. Initially, I thought I'd say
You
I,
overthink.
I thought I'd say IV administration maybe once weekly, but no, the safest one and the easiest one to ingest is oral.
Yeah.
Oral administration once daily, not twice, one times two. Mm, once daily, so that it
Once.
is not so overwhelming, and it, it's basically like a supplement. It is not overwhelming. We are not
Yeah.
curing illnesses. You don't need higher doses. You just need enough to give you the positive, to give you like the benefits of the chest itself without
Mm-hmm.
overdoing it so that it becomes overwhelming.
Mm,
Uh, so oral administration once daily,
mm.
like a supplement, so you can take it for the rest of your life. If you find it overwhelming, take a week break in a month and go back.
I love it. No pill burden, no chest burden. Mm.
Let me just
Yeah.
add on that. I make it a chewable tablet.
Yeah, you made it easy. You made it easy. You better be a tasty chewable tablet. See, ile unaonga.
Uh, yeah.
Nice. Awesome. It was amazing to have you. Thank you so much for gracing us with your time and also for agreeing to actually come to the podcast. Thank you so much for joining us at the Case Wellness Center podcast, where we look at things from a holistic approach as we get to the root cause of all issues. We were honored today to host a woman whose journey speaks to discipline, resilience, and quiet excellence. But beyond the board, she's navigating an equally demanding path in pharmacy, a field that requires precision, endurance, and deep intellectual commitment. We are grateful for always watching us, Good afternoon, good morning, good evening, wherever you're watching us from. Thank you.